so we can make sure we're ready to get going.
Hello.
Thank you, Patricia. Thank you, Moni.
Okay,
Michael, we see those hands.
We're good to go?
Good to go.
Okay, well, welcome back. I hope you had a bit of a stretch and are revived and ready to go on our exercise. And picking up on one of the earlier questions, what's a practical tool that you can use to help with the scoping stage? Now, the scoping note is really critical, and the scoping circle will be a series of questions that can help you examine your issue, why you're looking at it, what success looks like, etc., and systematically keep this updated as you go through many, many iterations of different conversations or research or insights or focus groups or inputs during your scoping phase. So this is the tool. You can start off anywhere really, but it's very helpful to understand the context. What's the system that the project is existing in and what it's trying to achieve? Then it's defining that problem, that question. What's the challenge that needs an answer? Then you want to look at designing your approach. What might meet those needs? So what's the kind of approach that you might need to help you? Why are people applying a futures approach to this? What is it about the dynamics over the future that you might want to understand? And what are the different types of tools that you might start to apply to get those insights? Then it's about design sensing. Who and what do you need to do this well and get the right insights? And what is the kind of evidence of change and data that you might need? Then it's about making the case. How will that evidence then and data come together to make the case for change? And what will different audiences want to see as a result of this work? And then managing change. Who's the project for and what needs is it satisfying? And how are they going to be included and what are you asking them to do? That's where the kind of vehicle for change thing comes in. So very quickly, I thought I'd illustrate that with an example of a project in health. We thought that health is particularly on people's minds, and in particular health systems are really thinking about transforming, and in particular around raising costs because of demographic pressures, technological innovations, but also the importance of prevention. So this really taps into that area. It's an example from Canterbury in New Zealand. And we're going to come back to this example later on as well, because it's interesting for various reasons. But in this example, I'll just tell you a little bit about the situation, which was that, like many health communities around the world, they've realized that they're going to have to double their staff and double the number of beds and double the number of doctors available because of the needs are really growing and they don't have the money to address that. So they were thinking, how can we really come together to bring all the different parts of the system, of the health system in that community, which is Canterbury in New Zealand, to really do things differently and to create better health outcomes for the community, but without the kind of expenditure that you'd need by doing things business as usual. So the Canterbury health community and the community of citizens was the context, the system, and they had a real desire to change and local power to do so. They defined the problem as the fact that there's the money nor the staff is available for future demands of healthcare. And in addition, there was some growing reputation and morale issues in the health board that actually ended up leading the process. So really needed to kind of get an understanding of, and also the health system was really quite fragmented. So is there a way potentially of bringing people together? And this was then the approach. Could they redesign the healthcare approach to kind of work together and to focus on prevention? because they're looking for a single vision that different organizations, whether you're in social care or primary care, or perhaps even a school or any other public service, could tap into, because it's about what is our vision for our healthy community. It then meant, in terms of sensing, that they needed to get evidence from experts, from the technology side of the house, because there's lots of interesting new developments, but also you need citizen focus groups as well as the kind of workforce focus groups, because there's changing health needs, but also you need to bring the health workforce on board, making the case, really helping people explore with citizens, what is care going to feel like for citizens? How do you make the case for why technologists might want to get involved and to support this and be part of this process? And then in terms of managing change, it was around bringing those 18,000 healthcare workers together, but also the board, who were critical to unlock the funding for doing a very interesting approach, which ended up being a participatory futures immersive approach, where you actually took about 25% of the healthcare workers through a kind of setup looking at what the future hospital looked like, what the future interactions with the healthcare system looked like, and to have them engage with actors who are pretending to be doctors and explore what that looked like. Sounds quite expensive. It ended up not being too expensive, but you do need to have the sign off of when you're doing something quite that innovative, of people involved. So what we're now going to do, we thought, was Marius and I thought we would actually then give you a little bit of a live example and run through of what we're going to be asking you to do on your particular project questions. So we're going to be asking you to complete the scoping circle for your project. And it might look a little bit like this. So we're going to role play another example that we did together. This was working with the World Health Organization on the future of food. So Marius, do you want to take it away?
Well, thank you, Kat. And let me start by saying thank you for an opportunity to find out a little bit more about this project and why it is that you've commissioned this project. And thank you again for choosing us to work with you on this. I guess my first question is about the broader context within which this work will take place. Is your regional coordinator positioned in a particular environment that we should be aware of, which provides a backdrop to the work?
Yeah, so I'm working in the World Health regional part of the Western Pacific and area across 22 different countries. But as an organization, World Health is really interested in zero hunger, and in particular, the social determinants of health and the social determinants of ill health and the link to food, and in order to help address SDG 2. So that's the kind of context, and we're really thinking through what that might mean for the Western Pacific region and how we might want to help some of our member states and the community here.
That's very interesting, Kat. Is there a particular problem at this point in time or a challenge that's emerged that you believe foresight engagement would be assisting you with?
Yeah, it's two things really. It's basically, we're really realizing the social and economic determinants of health are really important. But I think that probably people have underplayed perhaps a focus on food on that, and food and nourishment and nutrition feels really important. And very often when people look at it, they really very much focus on the issues to do with calories and calorific intake. But we think that there's something really interesting around the fact that actually food has got a very deep relationship with culture and community. And so we think that actually if you start looking out about the future of food and nutrition, especially taking into account all this huge technological innovation that's coming out, that we need to be slightly more imaginative and holistic in how we think about the future of food. And in particular, not just look at the demand side, but also look at the supply side and see how agribusinesses, suppliers, how food innovation and synthetic biology may just shake up the whole space.
So that's very, very interesting. So that broader framing of the future of food, as you've described it, in doing this work, we would obviously love for the project to have the maximum impact and be as relevant as possible. Do you have any guidance for us on how to approach the project to make sure that it is relevant?
Yeah, so two things really. As a result of the pandemic, we've been running some sprints, some virtual sprints on the future, really encouraging people to think differently. And what we found is that this can be a really powerful way of getting quite unexpected and different people to our organization come in and look at issues, for example, philosophers or data scientists or lawyers. And we found that very helpful indeed. And in particular, I think that's their knowledge that we want to tap into as part of that, and as well as working with different counterparts of ministries of health in different countries, perhaps selecting a couple of countries to work with first to see how that may pan out, and then going elsewhere afterwards.
So that's very useful. So almost a piloted approach with incremental learning along the way and building up from there. Another question we had is, as we communicate this work, not only in the findings at the end, but during the process itself, would there be specific ways of engaging that would be most relevant and useful given the individuals and organizations involved?
Yes, I think that it's important really to kind of understand the differences in the community. I mean, I just remember I went to the International Red Cross event and they talked about the future of the humanitarian space, and they had someone walking around in what a future of humanity suit looks like. So just by looking at someone or interacting with them, that you realized quite a lot of profound things about how their role as humanitarian workers might look different in 20 years' time. And that's the kind of effect that I might want to kind of get perhaps in to really powerfully communicate what we're doing, as well as, of course, making sure that it's really rigorous, because we've got lots of brilliant academics who are expert, and we need to make sure that we really kind of bring in their quantitative and rigorous academic expertise as well.
Very, very useful. And then one final question, if I may, Kat. We often find with this kind of work, there are a range of stakeholders that need to be engaged, some as gatekeepers, others as key allies that we would want to bear in mind. Any guidance for us on that?
Well, it's interesting because I think we've got an upcoming biodiversity summit, and also really that the main framing around this is because we have a decade of action on nutrition, and we may want to kind of reprioritize and reassess some of the actions that we're going to take. So I think perhaps looking out to 2045 would be a really useful way of making sure that we have a big enough time horizon to bring in the different people involved in this process.
Well, thank you again for a very informative discussion, and we hope to circle back to you in the days to come with our preliminary proposal, and then we can refine it from there. Thank you.
Thank you very much. So I hope that gave you a little bit of a sense of some of the kind of conversations you can have to complete the scoping note. Back to you, Marius, because I think you're gonna ask people to now take this into their own project areas.
Thank you, Kat. Very, very helpful indeed. If I could ask Kat, if you could jump to the next slide. We've got 2 slides, I think, excuse me, to go through before we get into our exercise. So colleagues, we are going to be taking some of these learnings right into an applied exercise. You would remember from the previous session that you have been allocated into groups. You would remember that in your group allocation, these are your learning groups, and so they're not your own individual foresight experiments. But in these learning groups, you have been allocated a general focus, which you share with the colleagues in the group. What we're going to ask you to do, and you can go to the next slide, please, Kat, is to build on the previous work that you did in those groups where you use the scoping circle. And what we're going to ask you to do is, in the groups, complete your scoping circle template. The template is available in HouseSpace under the group work tab. I'm sure Ruth will have a link to that. Thank you, Ruth, reliable as always. Continue to build on your theme that you explored using the Futures Triangle. Now, you might want to spend 1 or 2 minutes to make your theme more focused. In other words, if you were looking at conflict very generally, you may want to decide on a particular region or a national level and just refine your focus a little bit in order to make the exercise more manageable. But then there are really 3 steps. Start at a place in a circle that most easily resonates with your theme. Then work clockwise around the circle. You may also work anti-clockwise, but we find that working clockwise just gives it a nice flow, sort of goes from big picture to more narrow focus. And then finally, write up to 3 suggestions in your group scoping question. At some point, we will visit your group, and you'll notice that myself, Johan, Iman, and Darja will be floating around in and out of the groups to answer any questions you may have. And then, of course, 20 minutes won't be enough to complete the exercise. We do encourage you between now and Wednesday to go back into HowSpace and to work on that some more, either individually or as pairs or however you want to do that in your own time. But we're going to give you 20 minutes now to do that. And so unless there are any major questions, Ruth, you feel free to send us off into our groups. And then the facilitators will be around shortly to support you and answer any questions you may have. Thank you.